Hey, this is Preston. Just want to show you kind of some of the things that I've done so far on Tableau and what we'll be reporting to the Safety Committee for Environmental Care Tours. This is just with a quick snapshot of the data that we've collected over the last 6 months through Environmental Care Tours. And it's actually not that much data, but I've already been able to tell very quickly that this is a very powerful system. So here's what we have so far. Um, so I did a three-part story here. The first one, you can see in this violations by department chart that we can see kind of the big offenders by department. In the chart below that, violations by week, we can see that there was a big jump on October 7th, and that's easy to call out with a little box that shows that we started patient care areas on that week, so it's kind of telling. The next section, or actually for all the charts, we can filter by entity, and that's really neat to be able to show across all of our charts here on this page and highlight just the important data. That's huge. Just to be able to do that would take a lot of work with normal charting. That makes it super easy in Tableau. So you can see, East Campus, Children's Hospital, and Surgical Hospital. We can see in Surgical Hospital that we have kind of one area that kind of stands out above the rest, pharmacy there. As far as the violations by category, we can see that security, in the security program, employee knowledge of workplace violence and what constitutes workplace violence was kind of the big offender there for that program. And then we can also see everything all together. The cool part too about the chart in the bottom right is that we can sort the top violations and do an active filter to just filter what we want to see. If we want to see top violation, top 3, top 2, we can hone it down, and it makes the data extremely clear, and it separates that by entity as well. So it's not just the top 2 across the board, but it's the top 2 by entity, which is really cool because that would be like 4 separate charts in normal charting. On the second page, we have our EOC tours, and this is more of program performance reporting versus the last page, which was deficiency reporting. And we can see that the average score by entity is kind of between 100 to 99, so not a whole lot of difference there, but zooming in the chart really helps show you the variability. There's just not enough data on this, though, to be that effective, but it's a pretty powerful tool. And we can filter by entity on this page as well, and it filters all 3 charts. So you can see here that security is highlighted in yellow, so we're getting into a caution zone there for University Hospital. And if we go to the chart on the left, we can see that under fire safety we had 155 violations just by hovering over that. And then we can uncheck that and see everything together. And we also see that security in Surgical Hospital. So this is just another way of looking at the data that we saw on the last page too. But we can see the program average score for security and Surgical Hospital is pretty low. So that would be a focus area for education for security. So that's something that maybe we would have a feel of after the tours, but not until you see the data in this way do you have a good handle on where efforts need to be focused. If we go to the third and final page, we can dig a little bit deeper into egress. So this one is really telling because this first bar is the percent of times or the percent of tours that egress was cited as obstructed. And the second one is the percent of tours where egress knowledge was cited as deficient. So what this data says is, and obviously there's nothing under percent of egress knowledge cited. So what this data says is they know what to do about reducing egress obstructions. Unfortunately, the reality though is they're not doing it. Because we can see that for East Campus, we have a 33% of our tours were citing egress as obstructed, and for University Hospital, it's 40%. Whereas there was no times that it was observed 0% of our tours are citing egress knowledge as deficient. So very, very telling there. Then the final chart there is just the egress trend over time. So we can see per week which areas we're citing egress tours and how that's kind of jumped, especially when we get to the patient care areas in October. So overall, this tool has made reporting for environmental care tours much more efficient and much more telling. And the ability to do it in a story format like this is fantastic for our safety committees. And we'll definitely be presenting it to the safety committee in this way. We may make a little bit of tweaks before we actually present it to them, but this is fantastic, and the tool is so easy to use and to learn, and very customizable with the calculated fields and all the different things that you can do, and it makes it easy with just a drag and drop feature. So this has made my life a lot easier, and I think safety committee is going to be excited for the first time about environmental care tour reports, which they've had issue with in the past. So I'm very excited to present this data, and I think it's going to go well. But thank you guys.